All right, part 3 of the chronic care management. I feel like I'm making a TikTok and I'm like for part 3. Now you get part 3, yay. Okay, anyways, so we're in the patient's note. That's kind of where I left off. I showed you how to log your time. We did all that. So now we're in the patient's note. Now, the most important thing with doing these care plans, at least to me, or at least this chronic care management, is you got to have a plan. There's got to be a plan as to when to call the patients. Now, when you've only got 5 people enrolled, it's easy to keep up with them. But when you get up to 50, 100, you got to be pretty clear about when you're going to be calling them and checking on them. And I kind of like to make a decision about how often they need to be called and checked on based on my conversation with them and making the care plan, because that is going to determine what they need. Some just once a month, and then of course if they call and need refills or need certain things, that time can be logged. Now, if the phone call is one where they're calling saying, I feel terrible and I need to be seen, and there's back and forth between the physician or nurse practitioner, PA, and the patient, and that phone encounter leads to an office visit, that cannot be counted towards minutes towards chronic care, okay? So anything that leads to a visit by the patient, you can't log those hours. That's considered a part of the E&M visit or the telemedicine visit in the case that we're in now. So just keep that in mind. Now, I'm on the hub right now, and from the hub is where you have the option for actions. This is where you are gonna create when you're gonna call the patient, okay? So let's just say I talked to Mr. Blake Test, and I decided that he is a once a week patient that needs to, Jesus Christ, turn the phone off. Okay, sorry people. My kids are sitting around me and playing TikToks and stuff. So action type, you're gonna put, usually it's patient inquiry because you're gonna be calling them. Now the starred things have to be filled in: subject, general, assigned to. This is where you're gonna pick who you're assigning this task to. So I'm gonna pick me for right now, and let's just go right here. All right, and then status is gonna be always not started when you're making it, okay? Priority, you can say it's urgent or whatever, but and then here is where you put what you want to be done. This is where I put check on blood pressures, check on blood sugars, make sure patient made her wound care appointment, or make sure patient's going to her physical therapy, or whatever it is that you're going to be checking on. And so you put that in there, and then time stamp it saying that you're showing that you're doing it. And then if it's something that is going to be recurring, you're going to be doing it once a week, once a month, every 2 weeks or whatever, I do check recurrent action, and the frequency right here is where you're going to put once a month, okay? And then you're done. Okay, and let's see, so that's how you set the action. And then on the day that your actions are due, where it's going to show up is under the telephone encounter. It's not going to be in the encounter bubble here. It's going to be under the T, okay? It'll show up under actions, okay? And then when you click on that, let me make sure there's no patients that are going to come up. Okay, yeah, because she doesn't have any actions created. I have all the actions created for me. I'm not under me right now doing this care plan. So anyway, this is where the actions would show up that you have for that patient. You know, I think the key is to make the actions recurrent. That way, you know that you're going to be reminded, or that the person that's assigned to that patient to call them is going to be reminded. And I think it's good. The point of this is that we need to be reaching out to the patients at least once a month and checking on them, going over their medications and stuff. And what I hope that's going to do is decrease the amount of phone calls coming in from these patients, because we've already taken care of everything on the front end, which is going to free us up to continue, giving good care to other patients and keeping them organized, because we're not constantly answering, phone calls and fixing stuff. Instead, we're going to keep it straight from the front end. And just a quick little thing here. If you want to see that, this is the, PHM. This is where you can see a list of all of your patients. You can click on right here, and then I can't do it because it's going to pull up all of my patients, and that would be a HIPAA violation. But play around with this right here, because then you can go in, and then I can show you the top part. Let me. Okay. So I'm just going to come in from the top. So this is the top part. The bottom part is where all the patients are. But you can, essentially, this will pull up every single patient that's enrolled in the practice. And obviously you don't care about that. You care about the ones for your doctor. So you can select it based on the PCP. And then once you pick your PCP, you'll come over here and hit filter. And then that will, but you can pull up all the patients that have a certain amount of minutes, done. That way you could see at the end of the month who's got their 20 minutes, who doesn't, that sort of thing. So anyway, you can play around with this to, kind of keep an eye on your patients. And here under care planning, that you can also look at, you can pull up all the tasks and reminders for yourself by going in and, selecting this is assigned to Dr. Bickley, but she doesn't have any. They would be assigned to me. So you just put yourself in, and it'll pull up every single patient, task, and reminder all there, so you can kind of see it all in one place. All right. That's all I got for right now. As I learn other stuff, I will be sharing with you guys, but just feel free to ask me questions if you need it. My dad can give you my cell number, and y'all can text or call. All right. Good luck, everybody. Hey guys, there is something that I totally left out, so sorry. I'm going to add this in to the end. I didn't mention about due date. So this is where you would put the date that you want everything to start. I usually choose, if it's going to be a once a week thing, I choose, the next date, a week from that day, or some day that's going to be your call day, the day that you're calling patients, or of the 2 days you're calling patients, whatever. So you got to click the date that you want the action to start. And then it's going to actually, the telephone, encounter, the little T action or whatever, it should come, it'll be there in the morning when you get there, all your actions or whatever. So if you, set that, it should, that action, let me see if we can see. So I'm going to have it start today, and let's see if it, oh shooty pooty. Oh well, anyway, if all this is done and you set it to start today, then that reminder will come up under your actions. And then if you set it for next week, it's not going to show up in being due until, that day. And one other thing, let me just see, come to actions here. So when you go, you can go, all open as of today, or you can do all open all dates. That would show upcoming ones, This is just open ones. You can make it where you show things that are addressed, so you can, change what is being shown to you when you click into your actions, just FYI. All right, thanks guys.